Today we'll talk about something that we see often in the proctologist office, and that is a rectovaginal fistula. Now, a rectovaginal fistula is an abnormal connection between the rectum and the vagina. This can result from trauma related to childbirth. Sometimes it results from trauma related to a foreign body. And other times it results from inflammation within the rectum or the vagina, which may be related to radiation or inflammatory bowel disease, and occasionally it's related to an underlying malignancy in the vaginal wall, the cervix, or the rectum. Rarely we also see these related to foreign bodies that have been placed within the rectovaginal septum, and then those foreign bodies would need to be removed before the fistula can be repaired. Regardless, often the symptoms related to this are irritation of the vaginal mucosa, itching, worsening itching with recurrent urinary tract infections, and potentially the individual feeling the passage of gas through the vagina. Once the fistula gets large enough, they may also see stool passing through the vagina. Obviously, these can be very distressing symptoms, and because the symptoms tend to manifest themselves within the vaginal vault, individuals initially will usually be evaluated by their gynecologist. Once the fistula has been identified, the next step is to look for underlying causes of the fistula, and depending upon what the underlying cause is, the treatment varies significantly. It also varies based upon how severe the symptoms are. The basic things that we want to make sure are that if there's an underlying malignancy or an underlying inflammatory process, then those need to be treated before the fistula can be controlled, because otherwise any attempt to get the tissue to heal will fail. If the symptoms in the interim are significant enough, then we need to perform a diverting colostomy in the interim to prevent stool passage from the area and minimize the symptoms while we treat the underlying tissue to get it to be healthy enough to heal when we try to repair the abnormal connections. Eventually these colostomies are reversed for the most part. As far as ways of repairing the rectovaginal fistula, it is commonly repaired by the gynecologist, who will repair it through the vaginal area with manipulation of some tissue, some flap coverage, and closure with sutures, allowing it to heal. Colorectal surgeons and proctologists will repair these fistulas transanally, and sometimes we actually go through the perineum between the rectum and the vagina and go through healthy tissue in between to perform a transperineal repair of this fistula. For difficult fistulas or large fistulas, we work together and sometimes also get a plastic surgeon to come in and help to get some healthy muscular tissue as a flap that we can put between the rectum and the vagina to get the healthier tissue to heal and get this fistula to be controlled. Unfortunately, rectovaginal fistulas do happen. When they happen acutely related to trauma, such as childbirth or foreign body, they can be repaired right away if identified quickly. Whereas if they have an underlying inflammatory process or infectious process, then attempts at repair are delayed for a while, and individuals have to be helped to deal with the symptoms that this abnormality produces, and be guided through a slightly longer treatment process.